Chronic skin ulcers, whether resulting from diabetes, vascular insufficiency, or age-related skin fragility, present one of the most challenging aspects of healthcare. These wounds are often slow to heal, painful, and prone to infection, significantly affecting quality of life. Emerging research suggests that vitamin B3, particularly in the forms of nicotinamide riboside, NR, and nicotinamide mononucleotide, NMN, may offer a promising approach to support tissue repair and accelerate healing. By replenishing NAD levels, these compounds influence cellular energy, DNA repair, inflammation control, and microcirculation, all processes essential for effective wound closure and skin regeneration. One of the most important mechanisms through which NR and NMN appear to enhance healing is mitochondrial support. Healing tissues require enormous amounts of energy to fuel cell proliferation, collagen synthesis, and angiogenesis. As NAD levels decline with age or chronic disease, mitochondria operate less efficiently, slowing tissue repair. Preclinical studies show that NR and NMN supplementation can restore NAD in skin cells, improving mitochondrial function, increasing ADP availability, and thereby providing the energy required for rapid wound closure. In animal models of chronic wounds, NAD precursors have been shown to accelerate epithelial regeneration and enhance tissue resilience, suggesting that these compounds can directly impact the speed and quality of healing. Microcirculation, or the flow of blood through small vessels, is another area where NAD restoration shows clear promise. Efficient blood flow delivers oxygen, nutrients, and immune cells necessary for wound repair. NAD boosters have been linked to improvements in endothelial function and vasodilation, primarily through activation of sirtuins and enhanced nitric oxide signaling. Studies indicate that NR and NMN can support the health of endothelial cells, promoting capillary growth and improving local circulation within damaged tissue. This enhanced microvascular function not only speeds nutrient delivery, but also helps clear waste products from the wound environment, reducing oxidative stress and supporting optimal repair conditions. Inflammation is another critical factor in chronic wounds. Persistent low-grade inflammation can stall healing, degrade collagen, and damage surrounding tissue. NAD restoration through NR and NMN activates cellular repair pathways and anti-inflammatory mechanisms, including sirtuin-dependent modulation of inflammatory cytokines. Early research shows that this modulation helps shift the wound environment from a chronic inflammatory state to one conducive to regeneration. The reduction in oxidative stress and inflammatory mediators creates a more favorable cellular environment for fibroblasts, keratinocytes, and endothelial cells to perform their healing functions effectively. Clinical insights, though still emerging, are promising. Early human trials and case studies have reported faster healing times, improved tissue integrity, and better resilience in skin treated with NAD-enhancing strategies. Patients with age-related skin fragility, diabetic ulcers, or poor microcirculation have shown measurable improvements in wound closure rates when NAD precursors were incorporated into systemic or topical interventions. While larger, controlled trials are ongoing, these preliminary results underscore the translational potential of B3-based therapies in real-world wound management. Safety is another advantage. NR and NMN have demonstrated excellent tolerability in clinical studies, with few adverse effects reported even in older adults or patients with metabolic disorders. This positions NAD precursors as accessible and low-risk adjuncts to conventional wound care practices, complementing topical treatments, debridement, and pressure relief strategies. Dietary sources of vitamin B3, such as fish, poultry, peanuts, mushrooms, and whole grains, provide foundational support, while targeted supplementation can ensure optimal NAD availability in high-demand healing tissues. The broader implication of this research is profound. Chronic wounds are not merely a local skin problem, they reflect systemic metabolic, vascular, and inflammatory stress. By restoring NAD, NR and NMN support multiple organ systems simultaneously, improving cellular energy, circulation, and repair capacity. This systemic support may not only accelerate healing but also reduce recurrence rates and enhance overall tissue resilience. For patients facing prolonged healing or high ulcer recurrence risk, these effects could dramatically improve quality of life, mobility, and independence. Looking ahead, NAD restoration may become a central component of integrated strategies for skin repair, especially in populations with compromised healing capacity. Its multifaceted support, enhancing energy production, reducing inflammation, and improving microcirculation, demonstrates that vitamin B3 is far more than a nutritional supplement. It is a tool for activating the body's intrinsic repair mechanisms. Combined with conventional wound care and lifestyle interventions, NAD boosters could transform the way chronic skin ulcers are managed, helping patients recover faster, maintain healthier tissue, and reclaim comfort and mobility in daily life.